Eastern Cape doctors in the public sector are calling on the provincial government to address the understaffing issue that continues to plague the department. Doctors and nurses in the province are experiencing an enormous work overload due to the understaffing and the Provincial Department of Health's inability to hire more health practitioners. The doctors were hosted by the Provincial Department in East London in celebration of the inaugural Doctors' Day in the province. Themed Healing Hands, Caring Hearts, this engagement seeks to celebrate the work done by doctors in the public sector despite the demotivating conditions under their work. The doctors say while this acknowledgement feels great, they wish that issues relating to understaffing, shortage of medication and safety would be addressed in order to create a conducive working environment for them. While there are many unemployed graduate doctors longing to be employed and relieve the department of the understaffing issue, the department says it is not capacitated enough to employ more doctors. The provincial government says the health department is under financial constraints due to medico-legal cases that have eroded the baseline of the department, and the only solution to these challenges would be the National Health Insurance. And for more on this, we're now joined by Eastern Cape Health MEC Ntandokazi Capa, and she joins us now via our video link. MEC, thank you so much for your time this evening here on SABC News. Now, today you held the Doctors' Day in East London. Maybe tell us, what is the significance of this celebration?
Thank you very much, Mbali. Today we just wanted to say thank you to our doctors, because we understand that our province is a rural province. They could have chosen to go to another province, but they decided to remain in this province. And also we know that 90% of the people of the province depend entirely on the public sector. So it is important, therefore, to acknowledge the role that they play in giving a quality health care to our people.
And of course, as discussions were being held today at the celebrations, one thing that came out quite boldly is the issue around understaffing. As a department, how concerned are you, with the complaints that doctors have presented that understaffing is a major issue to healthcare facilities in the Eastern Cape?
Definitely, it is an issue, and we are concerned as a department, and we are putting strategies in place in trying to deal with issues of our finances, because we do understand that the issue that is putting us under the bus is the issue of the medical legals. And also we need to see what is it that we can do in terms of austerity measures in trying to get some funds for the department for us to be able to employ. And one of those is to look and analyze the issue of the committed overtime that we pay to our staff and doctors, and also to see the issues that we also provide and pay for their accommodation. So we're looking at those areas to see whether we can have savings so that we can employ doctors, can employ our staff in order to assist the health care in the province. But of course, we need to do a thorough engagement with the affected employees, with doctors, with everyone in the department, because we've put some austerity measures in the department in trying to make sure that we do have some savings so that we can be able to employ in the next financial year. But of course, the reason why we are also calling to say the issue of the NHI, it's one thing that can enable us to have more staff in our department.
And MEC, you speak about austerity measures being implemented to try and tackle some of the challenges facing the healthcare department in the Eastern Cape. When you talk about, interventions being made, do you think that this will be able to at least alleviate some of the pressures being faced by medical practitioners in the Eastern Cape?
Definitely, we can see that it's going to give us some good results. It's just that we need to have a thorough and due diligence in when we implement such austerity measures, because you are talking about people's lives, you're talking about their salaries. So if we are saying we have to review on how we implement the committed overtime policy for our doctors, we ought to have a thorough engagement with them. So that's what we want to do. And again, as I said earlier, that as the department, we provide accommodation for our doctors. But now we have to look at that and say we can provide you with accommodation, but what we need to do is to see, is it not possible for those that are in the areas where accommodation is available, can you at least pay a market-related rent for the facilities that we are providing you. But also, it has its downfalls because in areas like Nomtata, you have a challenge where you have a responsibility of making sure that you attract specialists to that area, because not everyone is keen to go and work in Nomtata or because of issues of crime and the fact that it's a rural area. So we have to have other means of enticing those daughters to come back. But we said when we implement these austerity measures, there will be an opportunity not to have a thorough assessment, and also to make sure that it's not a blanket approach. We look at a particular area and see whether we can continue to provide accommodation or we don't. But it won't be a blanket approach. And again, there will be a due process in engaging those that are affected.
And how, as a department, are you dealing with the issue around unemployed graduates? And I mean, doctors are much needed in this country. And as we speak to the doctors saying that, they need the necessary help, when it comes to those qualified graduates who are sitting at home, how do you plan on, accommodating them in these plans?
As long as we can have funds, we'll be able to employ doctors. But as I said earlier in the interview, I said one thing that we are doing as a department is do a thorough analysis, and then we go back to the Office of the Premier to say, this is what we find out. These are the plans that we think can be able to assist as a province. But as I'm speaking to you, we do have ComServes, because we know immediately they graduate, we have to take them as ComServe. So we do have quite a number of ComServes, and we'll continue to have ComServes, and they really help us as the department. And
what are your hopes for the Department of Health, particularly when it comes to dealing with doctors in the Eastern Cape?
As the province, we over the past 5 years we've managed to educate or train about 520 doctors, and also have about 76 specialists that are within the sector. Others, we trained about 96, but others, they went to the private sector. But we want to continue to have doctors in our space. We want to encourage to remain in the province, because we have a shortage of specialists. So if we train them and then they leave, it's a problem. That is why we are devising means to retain and make sure that they remain in the province. But as I said earlier, as long as we deal with the issues of medical legals, because we are calling out to say the issue of medical legals, we must devise other ways of paying this, because it has a direct impact to us as a department. Because once there's a court judgment, we have no option. We have to find money and pay those who are claiming us. And also we are calling upon our society to say we must not allow unscrupulous lawyers to come and make false claims so that they are milking the department. So we want to say they must be vigilant, but understand that if we continue to have these false claims, they have a negative impact on us as a department. As a result, it will be unable to employ necessary staff so that we are able to carry our mandate of giving a quality health care to our people.
Something else that the doctors raised, which is a concern, is the issue around the shortage of medication, and as well as safety for healthcare practitioners. How do you plan on resolving that?
The issue of safety is a challenge in the province, because everybody knows there's issue of crime in the country. But what we see now being done by the SABC is really giving us hope. But as a department, we've put aside 11 million, especially starting with Gqeberha, because that's where we are facing a huge challenge. We've got facilities that are closed because of crime. So we have prioritized Gqeberha, and we've set aside 11 million so that we deal with issues of security. We are putting CCTV cameras, panic buttons, putting fencing and all other security measures that can be able to assist us. So we are prioritizing the issue of safety in the province.
All right, MEC, thank you so much for your time. That is the MEC there for Health in the Eastern Cape, Ntandokazi Capa, of course, talking to us there about a day that they had set aside to celebrate doctors in the Eastern Cape.